My name is Bill Bowtell. I'm the author of a book published by Monash University Publishing, Unmasked, the Politics of Pandemics. I've been involved in Australian public health policy over 40 years, and from the beginning of the HIV/AIDS pandemic until the arrival on our shores of Delta, I've been able to observe and participate in the intersection between viral pandemics as they emerge and how Australia has responded over about 4 decades. And that was the purpose of writing my book. Nature creates viruses, but politics creates pandemics, and pandemics create new politics. Politics is process. It's as essential to human development as viruses are to evolution. Politics is how human beings build societies by arguing, agreeing, more or less, about how resources are to be divided and to what purpose. Politics reflects and shapes the human condition, but it's inherently and always conditional. It's relative, it's improvised, it's incomplete, an expression of whim and fashion and frenzy. As a process involving fallible human beings, it can never deliver absolute truths about human affairs. There are no iron laws of politics or society or economics, just as there can never be iron laws about culture, music, arts, literature, or beauty. Yet in every generation over the centuries, humans seeking wealth and power over others claim to have discovered just those immutable, transcendent iron laws, truths and principles, which, if applied, will bring order to the chaos of human life. The fabricators of stories and myth play on the insatiable human desire for hope, for an end to the endless journey, for peace and quiet in this world or the next. By claiming to explain the universe, they lead their followers to believe that the universe is also controllable by them, but they're wrong. Politics and science have never mixed well. Science is grounded in the belief that the reality of the universe is objectively so, and that it exists without human agency, permission, or politics. Science has provided staggeringly powerful tools that have transformed the world, destroyed and created empires and societies. And politicians have always sought to harness and subordinate the insights of science in the pursuit of their political goals and objectives. But the problem is that the truths of politics and science cannot both be right. Either truth is relative and shaped politically, or it is absolute and objectively so, beyond any ability of humans to alter or to deny that reality. There are indeed iron laws that govern and explain all things, but these are not the laws of politics. They are instead the laws of physics, chemistry, biology, and mathematics. In 2020, matters came to a decisive moment in the long struggle between bad politics and science. We're in the second year of the global coronavirus pandemic. The human misery and anguish caused by the virus has been immense. The direct toll of death, illness, infection is in the tens of millions and mounting. Those not directly affected by the virus have, of course, suffered from the evaporation of jobs in entire sectors of the global economy and the collapse from growth into recession. But the carnage was not spread equally among all countries. Some sailed through the emergency phase of the pandemic with low levels of infection and deaths and minimised long-term damage to their economies and societies. Coronavirus remained a serious public health problem, but never became more than that. Most, however, failed spectacularly in their efforts to see off the threat of coronavirus, and the problem morphed into a pandemic that upended them. How did this happen? Viruses jump from animals to humans ceaselessly and predictably. They're no more than mindless infection engines whose general characteristics are well understood by science. The properties of coronavirus are the same everywhere. So why did some countries control coronavirus from the outset, while many crumbled into its deadly embrace? The difference is entirely down to politics and people. Those whose leaders saw things for what they were, who planned and prepared and made the right decisions in time to make an impact, came through relatively unscathed. But those whose leaders placed their political interests above public health, science, and experience, who hoped for the best while failing to prepare for the worst, turned the problem into a pandemic. In doing so, they visited misery, death, and destruction on their people. Faced with the consequences, these leaders have sought to avoid responsibility and accountability. They proclaim that the emergence of the coronavirus was unprecedented, unpredictable, that its scything progress around the world was inevitable and unstoppable. This is rubbish. The peoples of the world have been badly let down by the venality, mendacity, and incompetence of those who failed to stop coronavirus in its tracks or to impede its spread. Prevention is always better and cheaper than cure. The costs of preparing and planning ahead to avoid the worst would have amounted to the tiniest fraction of what the world has been forced to spend to offset the consequences of rampant coronavirus. In Australia, good luck and geography provided just enough time and space to avert a dumping first wave. Then the commitment and tireless work of tens of thousands of frontline public health workers and officials, combined with the discipline and sacrifice of the Australian people, staved off the worst of the pandemic. But even so, shortcomings in strategy and management caused many avoidable deaths and infections and contributed to the making of politics or policies that have had profoundly bad social and economic impacts. Pandemics create new politics. Bad politics made Australia's coronavirus pandemic response much harder to deal with than it ought to have been. It took about 9 months from the first reported Australian case at the end of January 2020 until all Australian states and territories united around the goal of zero local transmission. In that time, some 27,000 people were infected and some 900 people had tragically died from COVID-19. Most of these infections and deaths were caused by the impact of an entirely predictable and avoidable second wave that struck only in one state, in Victoria. Poor strategic planning behind a veil of secrecy and based on an inappropriate model created uncertainty during the critical months of February and March 2020. In the confusion, the Australian government took a series of economic decisions that ended 29 years of uninterrupted economic growth, plunged the country into a deep recession, crippled many of the most productive sectors of the economy, and drove millions into underemployment and unemployment. The economic and social transformations caused by these rash and radical decisions will long impact the lives of Australians after the impacts of coronavirus itself have passed. The repudiation on 22 March 2020 of Australia's preferred model for dealing with coronavirus meant that at the very last possible moment, the nation veered away from the fate that engulfed the so-called peer countries of the United Kingdom and the United States, those consulted by the Commonwealth's government's advisors. Rather, thanks to the common sense of the Australian people, the dedication of the hundreds of thousands who comprise the Australian public health sector, By the end of May, the coronavirus pandemic in Australia looked more like those of our Asian and Pacific neighbours rather than those of our British and American peer countries. By October 2020, the difference was even more remarkable, as evidenced by the statistics. In that period, Taiwan experienced 510 cases and 7 deaths, Vietnam 1,074 cases and 35 deaths, but in the United Kingdom, they had endured 435,000 cases and until that date, 42,000 deaths. In the United States, over 7 million cases and over 200,000 deaths by October 2020. As the worst of the pandemic recedes, it's imperative that the entire response, the good and the bad, in Australia is scrutinised and assessed. The various reports commissioned into the Ruby Princess, Newmarch House, the Victorian Hotel Quarantine Program examined significant events, but these inquiries were tightly defined and did not consider the bigger pictures of strategy, implementation, and responsibility for outcomes. As we look forward, I think it's time to reconstruct our health system far more around prevention, as well as care and treatment. Only about 1 to 2% of Australian health funding is allocated to prevention, while 98% goes to care and treatment. We get what we pay for, care and treatment after the event, and don't get what we don't pay for, prevention of disease, illness, and early deaths. In their response to HIV and coronavirus, the Australian people showed they clearly grasped the wisdom of prevention. But the iron orthodoxy of the medical and scientific establishments prevailed to the detriment of public health and welfare. In my opinion, as we go forward, these are some of the most pressing reforms that should be made if the Australian people are to be protected from the impacts of the inevitable next viral pandemic. Firstly, the Biosecurity Act 2015 should be overhauled to remove all of the Commonwealth public health functions from the purview of the national security structures and re-establish them in a new public health structure based in or associated with an entirely revamped Department of Public Health. This structure should be responsible for public health and disease prevention, as well as the national coordination of pandemic planning and response. It must be grounded by default on the principles of transparency, accountability, and open policy making, and subject to oversight, scrutiny, and review. There needs to be a comprehensive independent review of Australia's response to all aspects of the coronavirus pandemic, including the interactions between health and economic policy making and policymakers, agencies, and departments. All Australian governments must overhaul and upgrade their public health structures, funding, and pandemic planning, drawing on the lessons and experience of the coronavirus pandemic so as to ensure the primacy of prevention. Internationally, the WHO, World Health Organization, should be profoundly reformed so as to provide greater transparency, accountability, and commitment to the prevention of pandemics, in line with the report made by the independent panel into pandemic planning, chaired by Helen Clark and former President Sirleaf. And even with the return of the United States to WHO, member states, including Australia, will have to substantially increase WHO funding to implement reform proposals. Finally, there must be taken into Australia's international relationships and planning the need to liaise, to talk to consult with all of Australia's neighbours in the Asia-Pacific region around pandemic planning. Beyond the practical reforms I've outlined here in relation to pandemic planning, we also have to understand that the coronavirus pandemic is just the most egregious symptom of the interlinked crisis that is overwhelming the planet. In 2020, the bill for decades of denying the science of both climate change and the threat of viral pandemics came due. In Australia, the year began with devastating fires caused by runaway emissions of carbon dioxide and other gases, followed immediately by the onset of pandemic disease. Australia paid a heavy price for ignoring and downplaying scientific truths. Molecules of carbon dioxide and particles of coronavirus are simply expressions of the iron laws of physics, chemistry, biology, and mathematics. It is delusional to believe that we can negotiate with molecules and viruses or overcome their effects by political means. The only way to prevail over the consequences of these iron laws of science is through the application of the same iron laws. We know how to reduce emissions and decarbonise the atmosphere. We know how to eliminate coronavirus almost entirely by simple behavioural means and to finish the job with vaccines and treatments. We know how to prevent the next novel virus from morphing from a local problem into a global pandemic. But bad politics is politics untethered from scientific truth. In 2020, 2021, bad politics crippled the health of millions, destroyed jobs, and collapsed economies, all of it playing out as planetary heating accelerated. In 2021 and beyond, only politics regrounded in scientific reality can begin to set the world on a path to the recovery of health, wealth, and happiness. In the wake of the Democrats' success in the November 2020 American elections, the Biden administration is faced with the consequences of its predecessor's failure to manage coronavirus in the United States. From the outset, the Trump administration claimed that public health must be subordinated to politics, and so the stringent measures required to contain the virus were inconsistently or not applied. No effective border control measures were imposed to stop the entry of infected travellers. The wearing of masks became submerged in the politics of the Trump re-election campaign. The almost unbelievable results of this rejection of science-based politics and policies were 3 increasingly severe waves of coronavirus infection, the deaths of over 700,000 people, and economic carnage and dislocation on a scale unmatched since the Great Depression. In the United States, the pandemic is now endemic. President Biden must pursue strategies that combine sustained behavioural change, especially the use of masks, with improved therapeutics. The advent of vaccines will help, but vaccines are not cures. Their efficacy will only become apparent over months as more people are inoculated. This means that, as impossible as the politics of lockdowns might appear, they will have to be implemented if other efforts fail to bring the pandemic under control. But of course, lockdowns, restrictions can only be successful if sufficient funding is provided to underwrite the incomes and businesses affected by those lockdowns and restrictions. Money is the most potent vaccine of all. If the stimulus and support packages are inadequate, the containment measures will be largely ineffective. Encouragingly, the Biden administration brings policies based on the best of American ingenuity, technology, and expertise. Above all, President Biden's administration is informed by science and evidence, not crude politics. The decision to rejoin the WHO will restore American influence internationally and hopefully lead to greater global cooperation and coordination for example, around travel. But President Biden has to confront the uncomfortable social and economic truths exposed by this disaster. The false dichotomy between the economy and health is at the heart of the neoliberal project that has held sway in capitalist nations since the 1980s. Spending on welfare of all kinds, including public health and aged care, has been slashed as taxes on the wealthy have been slashed. But the foolishness of this approach has become apparent. The lack of spending on universal health provision and above all prevention was a driver of the US spread of coronavirus. The redistribution of wealth from the rich to society generally strengthens public health care and limits the emergence of diseases. Redistribution is prevention. Investment in robust prevention, detection, and suppression measures would have stopped coronavirus before, not after it became a pandemic. And the cost of these measures would have been a fraction of what has been spent to date. Neoliberal economics treats spending on prevention and public health as an expense, a drag on productivity, while the hundreds of billions thrown at vaccine research and production is welcomed as a boost to stock markets and profits. 4 decades ago, coincidentally at the time HIV and AIDS emerged in the world, the Reagan administration embarked on a neoliberal experiment that subsequently swept the world. That experiment's run its course. It will now fall to a better, more decent American administration to relearn the lessons of another viral pandemic, repudiate neoliberalism, and hopefully build back better. Thank you.